Welcome to Health for Life, your trusted source for health and wellness insights, proudly presented by Vitruvian Health, the comprehensive healthcare system serving Northwest Georgia and Southern Tennessee with leading entities like Hamilton Medical Center and Bradley Medical Center. We're dedicated to keeping our communities healthy and thriving.
Welcome to Health for Life. Today we're talking with Dr. Sumedha Sonde, pulmonologist and critical care physician at Hamilton Physician Group Specialty Care in Dalton, Georgia. Dr. Sonde completed residency training in anesthesia and pain management and additional residency training in internal medicine. She then completed a pulmonary and critical care fellowship in New York. Dr. Sonde treats patients with sleep or pulmonary disorders, chronic obstructive pulmonary disease, also referred to as COPD, asthma, pulmonary fibrosis, lung cancer, COVID conditions, pneumonia, acute and chronic pulmonary hypersensitivity conditions, pulmonary hypertension, and a lot more. Dr. Sonde, thank you for coming on our show.
I'm glad to be here.
Well, I'm super glad that you're here as well. And today we're going to talk about lung cancer and like how it's diagnosed, treated, and what resources like Vitruvian Health can actually provide. And could you just kind of tell us why lung cancer prevention and treatment is a very important topic?
Of course, Noah. Lung cancer actually is my biggest passion in pulmonary medicine. Lung cancer is the malignant growth of cells in lung tissue. And, you know, in females, breast cancer is the most common cancer, and in males, prostate cancer is the most common cancer. Having said that, in both males and females, lung cancer is the second most commonly prevalent cancer, but it is the most common cause of death, unfortunately, in cancers throughout the country. Just to give you a few numbers, in America, the lung cancer mortality rate is about 32.4%. But in Whitfield County, that's about 44.3%. And 64% of these cancers are actually diagnosed at a late stage. And that's why it's so important for us to kind of talk about it and focus on early detection, because that's the most important thing in improving survival in our patients. No,
seriously. I mean, with you saying that most of them are found late stage, it's stuff like we're going to talk about today that can get those early stage detections?
Absolutely. Like that's my focus of today's talk, to kind of help us together catch it early. And so we'll talk more about how crucial it is and what we can do if we really catch these cancers early.
What are some like key risk factors and warning signs of lung cancer that people should watch out for?
Right. So smoking is the most common risk factor. Having said that, not just smoking yourself, but secondhand smoke is an important risk factor as well. Some occupational exposures like asbestos, silica, radon. Family history of lung cancer and genetic predisposition is also common. And what I would look out for is a cough that just isn't going away. Hemoptysis, which is when you're coughing up blood. If you have any unexplained weight loss or appetite loss or some kind of night sweats, of course, breathing difficulties, chest pains, and if you find yourself catching pneumonias way too frequently, I would kind of, look out for these signs.
How is it usually diagnosed? I mean, like when it comes time to find it, what kind of tests are involved when you're trying to detect this?
So routinely, if you have any of these symptoms, you'll seek help from one of the providers, and regularly they'll do either a chest x-ray or a CAT scan to help us localize this better. Based on our focus of catching it early, today there is recommendations for lung cancer screening. Okay. So anyone from the age of 50 to 80 who's had about a 20-pack year smoking history, meaning you've been smoking for about 20 years and you're more than 50 years of age, you will qualify for what's called as low-dose CT scans, because these are very low-dose radiation risk, and then you do them once a year, again, to make sure you don't have these spots on your lungs, and if you do, we're catching them early.
You mentioned something with, smoking being one of the biggest factors of this. You said secondhand smoke, and it just made me think of all the households that have children in them that might be breathing this in. Is that a real risk?
It is. Actually, we have been seeing a lot younger patients nowadays that also could have them. They claim they've never smoked their whole life. But again, it's these exposures. In cities, there's also exposure to pollutants and stuff like that that can contribute to your risk of cancer. So yes, that's something I would look out for.
It can be scary stuff, but I feel like stuff like this with early detection and, how advanced medicine has become, It's very cool. And I'm reading here about Hamilton Medical Center's, is it the ion, how do you say the
It is the ion bronchoscopy program.
Bronchoscopy program. And what exactly is that?
Okay, so very recently we launched our ion bronchoscopic program. If you roll your lungs out, they're as big as a tennis court, okay? And conventionally, if you have spots on your lungs, or historically, you could only access the inner 1/3. Now, most of your cancers, almost about 60%, they start in the periphery of your lungs, right? So, the question is, how are we going to diagnose? I'm saying we need to catch them early. So then how were we going to diagnose these nodules if we couldn't access it? So we very recently launched our ion bronchoscopic program, which is a robotic bronchoscopy, which lets me go to the very periphery of the lungs. And I kind of drive there using a robot. I park there and I do my biopsies. And we're catching cancers in the very early stages. And I'm able to access even spots that are 8 millimeters and less to kind of just see if that's cancer and address it sooner rather than later.
Wow. So once you get in there and you find possibly a real confirmation of this lung cancer, I mean, what happens after? What kind of treatment happens?
So there are different kinds of lung cancers. The two major groups we have are small cell and non-small cell cancers. Okay. And once we actually biopsy them, we get to the bottom of what kind of cancer you have. And based on that, there's different treatments. So once I actually diagnose or finish my biopsy, we then present our patients to what's called as a multidisciplinary board, which consists of pulmonologists and radiologists, radiation oncologists and oncologists, and the pathologists. So we present our findings and to this expert panel, and we actually together come to a decision as to what would be the best mode of treatment for these patients. If caught early, some cancers can just be removed via surgery. If, of course, you're not a candidate for surgery or some people are unsure if they want to go through surgery themselves, we have radiation oncology right here at Hamilton Medical Center, which has about a 90% rate of complete cure of this cancer. So when caught early, there's so many modalities that we are able to offer to our patients to treat lung cancer, which was something that we're only hearing now in the later years. Before, when we said lung cancer, it was a scary premise to everybody. But in today's day and age, we're able to offer curative treatment to our patients with lung cancer when caught early.
Wow. You mentioned surgery and like radiation therapy, all that kind of stuff. Is there anything else in that mix that could be an option for somebody?
Correct. So there's surgery where, sometimes they will just remove the tumor itself, or sometimes they might have to do some extended resection. In addition to that, of course, we have localized radiation, and then some people might need chemotherapy or what's called as immunotherapy. Okay. Now, what this immunotherapy entails is when we do these biopsies, we will send out your tests for what's called as next generation sequencing. So we kind of find out the genetic factors that are associated with it. And now we have medication that can exactly attack these said genes that are causing the cancer to help you again, give you a better chance at beating this lung cancer. So those are more options than just surgery and radiation that we can have based on what kind of cancer you have and what stage it's at.
How important is like genetic testing in all of this lung cancer overall?
It depends, because this genetic testing is done on the biopsy tissue that we have. We're not doing blood genetic testing so much in lung cancer yet because it does not have the same implications as it does in some other cancers. But when we get the biopsy tissue, based on the stage of patient's cancer, we send the tissue itself for genetic testing a lot of times. It's very important because, like I said, younger patients that are getting cancer, and two, we have direct medications that attack these genes that were causing the cancers, giving our patients a better chance at cure of lung cancer.
And with the Vitruvian healthcare system and like this, the whole team, what can you say is just so special about, what you guys are doing over there and all this local practice?
So the biggest thing is, one, we're able to offer this locally to our patients. So it actually starts way before we get to the ion. So initially what we have now is what's called as a cancer IQ model that's helping us increase awareness and talk more about lung cancer screening in the first place. So once we are doing the screening, if you do have a spot or a nodule on your lung, they will send you to a pulmonologist's office. We have a lung nodule navigator that will help us coordinate this. Then they'll send you to a pulmonologist's office. Once you come to our office, we'll see, based on the size and the other characteristics of your nodule, the urgency with which you would need the procedure. Once you get the procedure that week, we have this multidisciplinary meeting with all specialties, and we're hopefully then starting treatment as soon as possible. Our goal is to have a time to treatment of less than 30 days. The reason is if we cut down our time to less than 6 weeks of time to treatment, it has been shown to have a 13% increase in survival, which is so huge in our patients with lung cancer, and we are able to offer that right here in Dalton to our community.
I mean, we're getting to the end of the show here. I just want to ask you, what message would you have for people that are just maybe being affected by this right now or are in the very beginning stages of dealing with lung cancer?
Essentially, I just want to say, yes, lung cancer is serious, but earlier detection and our modern therapies are really making a difference. It's not like it used to be. We are actually able to change the outcomes in our patients with lung cancer. So I'm saying that don't delay evaluation of symptoms if you have them. Ask your physicians about, the advanced biopsy tools that we have. And we are, like I said, able to give you all the care right here in our community. So, just make the most you can of it if you think you need it. So Vitruvian healthcare system is committed to providing a state-of-the-art pulmonary and lung cancer services, and we're here to help you through this process.
Well, Dr. Sonde, thank you very much for just joining us today and, for teaching us about lung cancer. And for people out there who are listening, who are maybe just now being affected by this, or you haven't yet, it shows you how important it is. And thank you for joining us.
Thank you. Thank you so much for having me.
Hamilton Physician Group Specialty Care has offices in Dalton, Calhoun, and Ringgold. To make an appointment in Dalton, call 706-529-3072. To make an appointment in Calhoun, call 762-268-4904. And to make an appointment in Ringgold, you can call 706-841-0833. You may also visit vitruvianhealth.com/specialty care to learn more.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.